Dr. Al Danenberg is a periodontist, a certified functional medicine practitioner, a certified primal health coach, and an ADAPT trained health professional. He is here with us today to talk about how he has been successfully managing incurable bone marrow cancer for the past 2 years. Dr. Al, welcome to the program.
Thank you for the opportunity. It's exciting to be here.
Now, let's start with the questions right away.
Sure.
You were diagnosed with incurable bone marrow cancer in September 2018 and were given 3 to 6 months to live. Now, please tell us what led to the diagnosis, what symptoms you had, and how you were diagnosed.
Sure. So it's a long story, but basically, by the age, I'm 73 years old, but by the age of 66, I needed to change my lifestyle and my diet. And I went on a paleo type diet and incorporated paleo lifestyle changes, exercise, things like that. And I got extremely healthy. And between the age of 66 to 68, I lost over pounds without even trying to diet. But when you get your body's hormones in balance, you lose excess fat. I was on 7 medications for a variety of medical issues prior to that. And I was able to completely wean off every medication within 2 years from 66 to 68. I thought I was the senior poster boy for a healthy living style. And I started lecturing around the country, writing books, giving virtual consultations around the world. And I had been booked to speak at the Paleo FX meeting in Austin, Texas in April of 2018. That's when I was 71 years old. I was feeling great. But when I went to the meeting, and I live in Charleston, South Carolina, so it's several plane flights to get there. And when I got to the meeting, I had put a luggage bag on my right shoulder that started to make my shoulder sore, which was very strange. Got back home, everything was fine, except my shoulder just never seemed to heal right. And then the pain went to my back and then eventually to my chest area. And I started having some difficulty taking deep breaths. So I figured, I'm a little hard-headed, I figured I need to study. And I went to see my medical doctor, who I've been seeing for many, many years, 20 plus years. And I saw him August of 2018. And he said, well, look, I obviously see, and you're experiencing pain. I don't know where it's coming from. Let's do some basic blood work, CBC, some blood chemistries, and a high sensitivity C-reactive protein to see what kind of inflammation is going on. All of the blood work, all of the chemistries came back relatively normal, within ranges of normalcy. But the CRP was way out of line, and it showed systemic inflammation. I don't know, and he didn't know if it was acute or chronic. He didn't know where it was coming from, but something was wrong. So he ordered an MRI, and the MRI showed a vertebral compression fracture, several broken ribs, a hairline fracture in my pelvis, and a soft tissue mass on the side of my spine. So he started to joke around at first and said, did somebody beat you up, or did you fall down some steps? And I said, of course not. I was just carrying a bag on my shoulder, and I've been unbelievably healthy up to this point. So then he said, in a more serious tone, I think you have multiple myeloma, lymphoma, or leukemia. These are 3 cancers. Here I am, the senior poster boy for a healthy living, a lifestyle. So obviously, this is a devastating piece of information. He refers me to an oncologist. There are more tests, a PET scan, a biopsy, several things to look at my bone structure. And I see my oncologist for the first time with my wife and 2 adult children. And he's a marvelous guy, and he's still my oncologist, but he's very conventional. And he's telling me from all the data that I have what's called IgA kappa light chain multiple myeloma, with innumerable lytic lesions throughout my skeleton. That's why I'm having these pathological fractures. And he says, this is an incurable cancer. And he says, if I do nothing, I have 3 to 6 months to live. And that's in September 2018. Very, very devastating. I realized my life is definitely over as far as I was experiencing for the last 71 years. And he tells me to go start chemotherapy the next day, radiation for my chest because it's so difficult to breathe at this point, and I'm not a good candidate for stem cell therapy. So I'm asking him, why would I go on chemotherapy if this is incurable? And he says that the chemo will stop the disease. It'll put me in remission and I'll feel fine. But the disease will come back, and then I'll have to do new chemo, more aggressive chemo, because the original chemo would not work any longer. And then it would go on and off that way until I succumb to the disease. And I said, well, what's going to happen with my life as I progress from remission to disease to remission? And he says, your quality of life is going to decrease. It's going to go down. And he also said that patients with this kind of multiple myeloma generally die from anemia because of bleeding internally, because of the red blood cells are getting pushed out by malignant plasma cells, or kidney failure, or an infection that is unable to be treated because my immune system would be so shot. This is not the way I want to continue my life. Plus, I'm feeling great, except I can't breathe well. So I do accept the radiation just for my chest. That's not going to stop the disease. It just treats the pain that is because of the broken ribs. So I did that. That was fine. I reject chemotherapy and I create my own cancer protocols that did me extremely well. Never went in remission, but never got worse. And I stayed pretty healthy for another year until August of 2019. And in August of 2019, knowing that my bones are a little brittle, I've had a few fractures along the way, I'm very careful. So I'm in my bathroom and flossing my teeth. And I go to throw my dental floss away in the trash can that's left of me. So I twist maybe 90 degrees to the left, and all of a sudden my right femur splits in half, and I crash to the floor. I break 2 more ribs, and I fracture my right humerus in half. I am writhing in pain. I know that I've lived more than a year or about a year beyond my prognosis. And I can't believe that my quality of life would ever be the same at this point, and I'm ready to die. My wife obviously comes in. It's a very emotional time. She calls EMS, the emergency services. They take me from my home by ambulance to a hospital. They fix my right femur because it's going to puncture my femoral artery and I would bleed to death. They don't fix my right humerus, and I'm ready to die. I really am ready to die. So they give me all kinds of narcotics. I'm catheterized. They send me to a hospice hospital to die. So in September 2019, I'm in a hospice hospital, and all of a sudden a hurricane comes through Charleston, and it's threatening the hospital, and they're ordered to evacuate all their patients. They don't know where to send me. They send me to my home where my wife is a nurse, and we get a hospital bed. She gives me a little tough love at the house, and she says, look, you are not a victim, you're a survivor. All this time, you've done so well with your unconventional cancer protocols. Let's get you back on those. Let's get a physical therapist in here, and maybe we can get you better. Amazingly, I get better. I rally. I'm on my protocols again. I revoke hospice, and I start getting around on a walker, and the catheter comes out, and I'm starting to wean off all these narcotics. I go back to my oncologist the next month, which is October 2019. He's amazed that I'm still alive. And at that point, there was a new drug that was approved by the FDA in the United States for immunotherapy drug just to support my immune system and help kill my malignant plasma cells. It's not chemotherapy. So I start that. And then within several months, we want to get a new cancer PET scan to see where the cancer cells are. So in May of 2020, I have a new PET scan, and the PET scan shows no active cancer cells throughout my entire body. Now, I'm not in remission. I've not cured this disease, but I have improved my immune system to such a point that I am certainly beating this thing and keeping it at bay so that I could live another 20, 30 years like this without being in remission, without active cancer too. So I am thriving. I'm loving it. I'm doing extremely well. And it's an interesting story. And I think the cancer protocols have absolutely improved my quality of life and the ability for me to thrive.
Awesome. Now, but at some point you go from paleo diet to carnivore, correct?
Yes, yes. So when I start this diet, I mean, I started the paleo diet at the age of 66. I'm diagnosed with cancer at the age of 71. I switched from a paleo diet to a paleo autoimmune diet at in September 2018. Now I'm doing some research, and I'm very geeky, and I'm doing a lot of research, and I'm always improving my cancer protocols. And I found a clinic in Budapest, Hungary called the Paleo Medicina Clinic. The Paleo Medicina Clinic has been in existence now for 10 years or so, and they've treated over 5,000 patients. And these patients are either suffering from severe chronic diseases and cancers that are curable or incurable. But they are treating their patients with a diet they call the Paleolithic ketogenic diet, which is a strict animal-based diet, no plants, and no supplements and no pharmaceutical drugs. They are getting amazing results, and they're publishing their results in various journals. And of course, they're translated into English so I can read them. And I am so impressed with the science, the clinical medical results, and the science behind it that I do more investigating. And by January 1st, 2020, I switched from a Paleolithic autoimmune diet to a strict animal-based or carnivore diet. And that's what I've been on ever since.
Mm-hmm. So can you tell us what you were eating when you were on the paleo diet and what you were eating starting on January 1st, 2020?
Sure. So the paleo diet is basically animal products, nose to tail, that are certainly pastured, grass-fed. They're not eating or being fed any kind of chemicals or processed foods. They're eating off the land. In addition, I'm eating all kinds of plants, all kinds of vegetables, fruits, nuts, and seeds. Everything, of course, is organic and no chemicals added whatsoever. That would be the Paleolithic autoimmune diet would be eliminating most or all of nightshades and maybe some other products, certainly cheese products, dairy products. Now, the carnivore diet eliminates all plants. And the fascinating subject is that plants basically have a lot of substances that we need to eat, but they have a lot of unhealthy substances called anti-nutrients. And these are designed by the plants to help animals not eat them so that they can propagate and thrive for generation after generation. But these anti-nutrients, our digestive system has never evolved to break down. It's just the way our DNA code works. We don't have the DNA to make the enzymes to break these nutrients down, anti-nutrients down. Now, some animals do, and cattle and other ruminants can process this food, plant food, absorb the nutrients, and they are now bioavailable to us without the anti-nutrients. But we cannot eat many of these plants because the anti-nutrients are damaging our gut microbiome. They're damaging epithelial barrier to our gut. It's causing what's called a leaky gut and creating metabolic endotoxemia. highly infectious and inflammatory, affects all organ systems, encourages cancer, and it does a lot of bad things. And that's what I am not eating anymore by eating a carnivore diet.
So what are you eating right now? What does your typical day look like?
So interestingly, when you're eating an animal-based diet, nose to tail, and you're eating a fat to protein ratio of 2 to 1 measured in grams, you are not very hungry. So I eat maybe once a day. I only eat when I'm hungry. I eat maybe once a day, sometimes twice a day. I'll eat eggs. I'll eat certainly ground beef, steaks. I'll eat all kinds of organs. I will eat all the saturated fats and all the collagenous material in some of the very tougher meats that we cook, slow cook, or put in an Instant Pot, and drink the juices, which are the juices that have a lot of fat and the collagen, basically bone broth. And that's what I eat. And I'm totally satisfied. I eat seafood, I eat shrimp, I eat all kinds of oysters and mussels and clams and a variety of shellfish. But again, I eat when I'm hungry, and I'm doing very well.
So, but you are looking that the fat to protein ratio is 2 to 1, yes?
Yes.
So, and how do you do this? How do you determine whether you have met?
Well, first of all, 2 to 1 is kind of like approximate. So I'm not doing it by the numbers. I'm doing it by visual inspection, basically. I know when I get a pound, let's say, of grass-fed, grass-finished ground beef, I know how many grams of protein and grams of fat are in there because it's on the label. When I cook the ground beef, I will add extra fat. I will add either ghee, which I use. I will add either extra tallow, which is beef fat, or lard, which is pork fat, to my cooking, and I'll eat that. So I know that I can get that. I do deviate a little bit from a strict carnivore diet. I sometimes will use MCT oil that will give me an extra boost for my ketones, because I do stay in ketosis. I know that I'm in ketosis because I can measure my ketones. I use a ketone meter to know where I am. I am very metabolically flexible. I've done a continuous glucose monitoring to identify my glycemic variability, and my glycemic variability is in a significantly low range. So I am metabolically flexible. That means that my body knows how to burn fat for fuel. And when I'm having some carbs, it knows how to burn carbs as fuel. And I try to cycle out of ketosis maybe once a week, just eating carbs to maintain this flexibility. So in that carb day, which is probably contrary to a carnivore day, my carb day will consist of eating some fruits, which have very, very oxalates, phytates, and lectins, which are the anti-nutrients. And I'll eat raw honey. Raw honey is an animal product, by the way, but it is high in carbs. So raw honey, although it has 200 biologically active chemicals, which is amazing, also raw honey has about 17 grams of carbs per tablespoon. So I can eat several tablespoons of raw honey and some fruit, cycle out of ketosis by eating 100 to 150 grams of carbs that day. And I know that I'm metabolically flexible. So I'm incorporating a lot of concepts with this animal-based diet to make my body very, very healthy and support my gut microbiome by using certain types of spore probiotics to enhance my diversity of species in my microbiome, in my gut.
Mm-hmm. Okay, now one thing that interests me is that, okay, basically, if I understood this correctly, you had been on the paleo diet for 5 years before your diagnosis,
Yeah,
right?
why would I get cancer, right? Let me tell
Oh, no,
you.
no, 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 no,
Oh,
no.
okay.
What
Okay.
actually, no, no. What interests me is how you were able to not fall into the vegan trap, because normally people would think, oh, maybe it was the diet that I was on that contributed to the cancer, so let me switch over to a vegan or a vegetarian diet. But you went exactly into the opposite direction. And you said,
Correct. So all my research, starting a paleo diet, my research showed that a paleo diet, an animal-based diet, is healthy. And all my research showed a vegan diet was never healthy. I never, ever considered a vegan diet or a vegetarian diet. But when I was diagnosed with cancer, all of my research, and again, I was doing research that was based on human evolution. If you look at human evolution, it will show you that there has never been a vegan society that has thrived, ever. That says something. If we look at the physiology of our digestive system, it has evolved to be more carnivore than herbivore. We're omnivores. We can eat plants, no question. But our digestive system is designed better to absorb and digest animal products. For example, we have a stomach that has an acid level of pH of 1 to 1.3. It's designed to kill a lot of microbes that are rotting meat. It helps protect us when we're eating meat. We have a long small intestine. That's where most of the animal products are digested compared to primates that are herbivores. And we have a very short large intestine, which is where all the plant material will be digested. Now, primates have a very long large intestine so that they can digest these plant materials because they have the enzymes to digest all these anti-nutrients, but we don't. So our physiology is designed more towards animal-based foods. Our evolution has shown that no vegan society has ever thrived. And the only reason we are the way we are and we have the brain and capacity that we have is that we've been eating, as we evolved, animal-based marine life to develop the brain that we have. So there is no question in mind I was going to be paleo and not vegan. And I never considered vegan diet. And all the research I read when I had developed cancer certainly showed that a vegan diet was not the right way to go because I was leaning towards our evolutionary development and not what was decided the last 10, 20, or 30 years.
But I'm sure as a practitioner, well, and as a cancer patient, that you have heard about the Gerson diet, right?
Of course.
And
So
I mean, there's so many amazing testimonials.
Sure, of course. So
apparently the research is overwhelming, and all that. So how
of course. So anybody that's on the standard American diet, like 95% of the people that live in the United States are on, and most civilized societies are on these very overprocessed foods. If you start a vegan diet, you are going to get extremely healthy because you're getting rid of this terrible diet. So without a doubt, a vegan diet is so much healthier than a standard American diet. Now, also, every vegan has to take supplements of some sort because they're not getting the animal-based nutrients that they need. So they're substituting chemicals and or various processed nutrients to help them get back to what they would have if they were on at least an animal-based diet by 70% and maybe a plant-based diet by 30%. So you can have plants as long as you are not eating the anti-nutrient plants. So most of the fruits fall into the category that are acceptable on a carnivore diet as long as you're eating less than 30% in volume of a plate of food. So 70% or more animal-based foods, 30% or less plant-based foods that are absolutely low or have no existing anti-nutrients. So that's the way the diet should be. But a vegan who's eating 100% plants needs the nutrients from the animal-based area of diet, but they're not getting it by eating the food. They're getting it by taking supplements. Many of them are synthetic.
Mm. So
But
now,
they're getting okay. They're getting better. They would get a whole lot better, I think, if they were on a animal-based diet. And all we have to do is look at paleomedicine in a clinic.
Mm. So now you have been for slightly over a year on the carnivore diet. So tell us
Yes,
how you're doing. How do you feel?
I feel amazing. So I am feeling like a very healthy 73-year-old guy who's going to turn 74 shortly. And I only have limitations because of the complications of all my pathological fractures. So I've had so many bones in my body fractured, but I'm doing well. I exercise. I walk outside a mile a day, but I use a rollator when I walk so that if I were to get weak on my legs, I wouldn't fall. If I were to fall, it would be devastating. I would fracture a lot of bone tissue. Um, I do modified exercises in the house, body weight exercises, modified squats, modified push-ups. So I do a good bit. I feel great. I have fantastic energy in the morning. I do get rather tired by 6 p.m. or so at night. And I have no problem with bowel movements. I have no problem with uh, any stomach distress. I have no problem with uh, physically doing what I want to do, other than knowing I have to be careful because of my fragile bones.
Mhm. So now you're saying that you are not in remission,
I am not.
but there are no active cancer cells. No active cancer cells have been found in your body during the last test. Now, can you explain this? Because this is not quite
Sure.
clear to
So
me.
a PET scan is a big CT X-ray from head to toe. They inject radioactive glucose in your bloodstream, and the cancer cells will gobble up the radioactive glucose and it'll glow on the X-ray. So the PET scan will show moderate to large amounts of cancer. It will not show small amounts of cancer. And that's probably where I am now. Right now, I do have quite a number of dysfunctional IgA antibodies that are forming from a variety of malignant plasma cells, which is part of the bone marrow tissue. And that's where the cancer is, but it's not in remission, meaning that the cancer cells are gone. The cancer cells are there. I'm not sure that they are very active, but they're there. And my IgA dysfunctional antibodies are staying at about the same number, not increasing and not decreasing. So that's why I am not in a state of remission, but I am in a state where I feel fantastic. And my oncologist says, well, he only treats cancer patients. He's never had a patient like me without ever going into chemo with the success that I've had. And I believe that I've improved my immune system to the point that it's compensating for my problems with the plasma cells.
Mhm.
Not all my plasma cells are malignant, obviously, but I'm thinking that it is in control. And he feels that I could live decades like this without even progressing. But right now, I am not in remission. I may get into remission as I continue with what I'm doing, but right now I'm not.
So what would have to happen to be able to say that you are in remission? How
So
would,
all of my plasma cells would not be malignant any longer, and I would not have a large number of dysfunctional antibodies, IgA antibodies being created, because those are created by malignant plasma cells. So
Mhm.
that would be the sign that I am in remission or maybe even cured.
Mhm. And so where are exactly those cancerous cells? Where do they show up on the PET scan?
The PET scan shows it throughout my body, but right now it's not showing at all.
Mhm. Aren't you a
So
little concerned? You said that a PET scan consists of injecting radioactive glucose solution. Aren't you
no, it's only for that PET scan. No, I'm not concerned about
you're not
that.
concerned? Okay.
No.
Um,
So I'm going to continue exactly the way I am, and
mhm,
I'm feeling. You know, a lot of it has to do with attitude, also. You know, there are so many things that can harm a body, and diet certainly can harm a body, and damage to the gut microbiome can harm a body. But if you are under emotional stress, you could be the healthiest person in the world, theoretically, doing everything right, and you can really damage your gut microbiome and create all kinds of systemic and chronic diseases. So I have to have a mental attitude that is extremely positive, which I do. I also have to have some physical activity, which I do. I have to have very healthy sleep, which I do. So there are many, many factors. And there's another factor that is actually totally unique, I think, from all of these aspects. And that is I have to help maintain my cell membrane, cells in my body, and the ability for me to produce healthy mitochondria and ATP. And I do that with pulse electromagnetic field therapy, which supports all of the issues that I just mentioned, that basically re-energizes individual cells. Cancer is a disease of metabolic dysfunction, which I can take care of by taking care of my diet, my gut, and also mitochondrial dysfunction. And to help my mitochondrial dysfunction, certainly being in ketosis will help, certainly exercise will help, but I can use pulsed electromagnetic field therapy that literally re-energizes individual cells of my body and helps repair mitochondria to help establish healthy production of ATP, which is the energy of every cell. So that is all part of my unconventional cancer protocol. And I believe that not just one thing is the answer to what I'm doing. I know my immunotherapy is helping, but I also know my diet is helping, and to get my gut microbiome extremely healthy is helping, and to support my mitochondria is helping. All of that is is a critical factor.
so yeah, playing devil's advocate, do you believe, or is it possible that it was this monoclonal antibody immunotherapy that you received that played the major role in you feeling better?
No, because I was in hospice in September of 2019, ready to die. I got home because of a hurricane that that allowed the hospital to send me home, and I was still in hospice. My wife, who gave me some tough love, got a physical therapist in and started me back on my uh, unconventional cancer protocols, which were not immunotherapy at that time, got me to revoke hospice and actually begin to rally. So my rally started because I got back on a healthier diet and my pulse electromagnetic field and returning to a healthy gut microbiome. The fact that I broke all these bones was the result of all the damage from multiple myeloma, probably for decades. It just didn't manifest until all of a sudden I was diagnosed. But that got me back on track. The immunotherapy was another factor to support my body's healing. I am not against conventional medicine. I am definitely convinced that an integrative approach is important. The problem is conventional medicine doesn't look at diet, doesn't look at the biome, doesn't understand the mitochondria. I don't understand where they're coming from. But what's very interesting is that there have been several peer-reviewed articles in several oncology journals that talk about we need to really get involved with understanding pulse electromagnetic field therapy for cancer. We really need to get involved with understanding the gut microbiome for cancer. As a matter of fact, there was a paper that was published just a couple years ago that showed people that are on immunotherapy are only successful 20 to 25% of the time. And it also indicated that the reason they were not successful is mainly because the gut microbiome was dysbiotic, an overgrowth of terrible bacteria. So 20 to 25% were successful only because they had a healthy gut. 70 to 80% were not successful because they did not have a healthy gut, meaning that oncologists need to get an awareness of the importance of the gut microbiome to support their immunotherapy. So integrated medicine is where it's at, I think. But right now, conventional medicine doesn't understand all these other facets that I've incorporated in my unconventional cancer protocols.
Mm.
So to answer your question, yes, immunotherapy is very important, but it's only one of my 10 unconventional cancer protocols that I think are very, very critical.
Mm. And now, what does your oncologist think about your diet? Have you told him about it at all?
Oh my God, he is phenomenal. That's why I still see him. He's conventional mainly because he is in a large group and he would lose his life if he suggested anything that I do to his other patients. But interestingly, he asks me to bring him the articles that I am reading in peer-reviewed journals that support my unconventional cancer protocols. He reads my blogs on my webpage. So he is very interested in what I'm doing, which is fantastic.
Wait, did you say that he would lose his license if
Oh
you
yes,
recommended
absolutely.
the
Oh
current?
yes, of course. Because he has to practice by means of the standard of care in the United States. Standard of care means chemotherapy. Standard of care does not mean a diet.
Yeah, it's when you think about this, it's I can imagine that thousands of people get killed because of standard of care, most probably.
They are. They are, without a doubt.
Yeah.
I mean, let's not get into it, but there are so many treatments that are harming people.
Mhm.
As you know, treatment does not get proactive. It doesn't get to the underlying cause. The main underlying cause is a breakdown in the immune system. What I have accomplished is methods to literally create a robust immune system for myself. And I know that because I have these biomarkers that I test that tell me I'm way above the average healthy person when it comes to a robust immune system today.
Mhm. Now, I'm sure you have also heard about Dr. Nicolas Gonzalez and his cancer protocol and his use of
Sure.
proteolytic enzymes. What do you think about that?
Well, I understand proteolytic enzymes help to break down the biofilm that is surrounding cancer cells and helps it to become affected better with other medications. My approach is to not so much kill the cancer cells specifically. My approach is to make my immune system strong enough to kill the cancer cells in a natural way.
Mhm.
So I know that Dr. Gonzalez used many nutrients supplements per day. As
Mhm.
a matter of fact, when I started my cancer protocol um, in September 2018, I engaged with a integrative medical doctor who was probably more thinking in terms of supplements to cure my cancer. And he didn't discuss diet at all with me. He didn't discuss mitochondria at all with me. But he put me on 70 supplements a day. And most of them were synthetic. And all of them included inert materials that were not good for the gut microbiome by themselves, but times 70 I thought was giving me a lethal dose of inert bad ingredients. And after I started doing more research and not getting really better from him other than taking a lot of supplements, I fired him and did some more research and just got off of all those supplements.
Mhm.
So I'm in agreement that if you're on a bad diet, anything and everything is going to be better. You could take a million supplements because you're probably deficient in a lot of stuff, but why take these in an unnatural method of ingestion? Why not take it in food that where the nutrients are biologically active? And that would be animal-based foods, but it's not just muscle meat. That's not a good diet. You have to have muscle meat, you have to have the fat, you have to have the collagen, and you have to have the organs. And if anything is important, the organs are critical.
Mhm. So can you tell us, you say that you eat a little bit of berries and some other fruits with
Yes,
meat. What exactly is it? Can you list that?
sure. So I will eat possibly up to 10% in volume of my plate of food with some fruit. And that fruit would be maybe blueberries or um, grapes, maybe an apple, um, not all at one time. But I would just maybe those fruits would be the ones that I would select. Mango, those are ones that I would select. They're very, very low in anti-nutrients. They add a little bit of variety to my meal, and I like it. And I stay in ketosis because I know that I'm in ketosis because I measure it. So it's not affecting the health of my body, and all the nutrients that I really, really want are there in the animal products. So it's
Mhm.
about 80 to 90% animal products on my plate, maybe 10, possibly 15 or so percent fruits
Mhm.
occasionally.
No, but when looking at your unconventional cancer protocol and you have a PDF file where you have listed what all this entails,
Mhm.
there are also some supplements that you take, right?
Yes. So I have been taking uh, spore-based probiotics. That's an important supplement. I do take vitamin D3 because I am not able to get into the sun in an effective way. My vitamin 25 hydroxy vitamin D level is a critical level for for everybody, for cancer patients. I try to maintain it between 60 to 80 nanograms per milliliter. The normal healthy dose would be maybe 40 to 60 nanograms per milliliter. I try to do 60 to 80 nanograms per milliliter. In addition to vitamin D3, I take vitamin K2. That's very important because if you just take vitamin D3, you can get a dysfunctional um, metabolism of calcium, and it will go into soft tissue instead of bone. So you have to have vitamin K2 that directs the calcium into bone tissue and not soft tissue. So that's important. And I was taking, although I'm not taking any longer, some other bone products, but I'm only dealing with the vitamin K2 now and the vitamin D3 and the spore-based probiotics.
Mhm. And the PMF helps you with some pain that you experience from the fractures.
So let me tell you, this is just absolutely amazing. Pulse electromagnetic field therapy, and there's a lot of research in PubMed, years and years of research in the medical field, healing soft tissue and bone tissue. It's very good for patients that have osteoporosis. So um, what I have found, and I'm not only using it for supporting my cell membrane and the mitochondria. What I have found is that it helps with bone pain. I am in pain 24 hours a day, 7 days a week. Now, I tolerate the pain. It's not excruciating. I don't even take ibuprofen for it, although occasionally I might, but very, very rarely. But I've found that when I use the pulse electromagnetic field protocol that I have 3 times a day, my pain is amazingly tolerable. If I am not using it, I know that my pain significantly is more difficult to deal with. And the reason is that it increases and enhances circulation. And oxygenation, and probably it is preventing the any inflammation that is affecting the nerve tissues. That's my guess. I don't know for sure. I
Mhm.
could just tell you that it is amazing if I do use it and I don't use it. So I know I'm going to use it.
Mhm.
Mainly was using it for supporting my cell membrane and the mitochondria and the ATP production. And that may be the reason why it is affecting my pain level. But now I know physically that my pain is much more tolerable when I use it, and I do use it 3 times a day, and I don't skip it.
Now, what do you think about high dose intravenous vitamin C therapy, and have you tried it?
First of all, I don't think it's necessary. It's pushing a product that is not natural. All the vitamin C you need, you can get from liver. And vitamin C competes with glucose to get into the blood cells. Vitamin C is only effective if you're in ketosis. So that when you're in ketosis, your body is producing natural glutathione um, from process of the NRF2. And that can help vitamin C as an antioxidant. And the vitamin C from liver, without levels of high glucose, get into the cell membrane and through the cell membrane very rapidly. When there is a lot of glucose, a lot of carbs, if you're on a carb diet, you are competing with vitamin C and it can't get into the cell very well. That's why you have to load it up very high with artificial vitamin C or supplements or IV vitamin C just to push it into the cell. Same thing is true with magnesium. Magnesium competes with glucose to get into the cell. If you're not on a high carbohydrate diet, you'll have better efficiency of getting magnesium and vitamin C into the cell. And if you're eating organs, especially liver, you'll get all the biologically active vitamin C that you need. And it's in a little different state than the vitamin C from plants. Vitamin C from liver is heat stable. Vitamin C from plants is not.
Mhm. But I was mostly asking because there's some anecdotal evidence about
Oh, yes.
vitamin C and cancer. Um,
Yes, I agree. And it's just pushing very, very high doses just to get into the cell. And I think that if you do it more naturally, you're not getting the overdose of vitamin C, which can cause other problems.
mhm. So, Dr. Al, are you available for consultations, or if people would like to contact you, how can they do this?
Absolutely. I do virtual consultations literally all over the world. On my website, drdanenberg.com, that's DRDANENBERG.com. There is on the navigation bar a little couple words. Um, I can't remember exactly the words. Let me help you, something like that.
Mhm.
And if you just drop down the box, it'll talk about the consultations.
Mhm. Okay, great. We will also link, I will link to this unconventional cancer protocol. And
Sure.
yeah, if people have more questions and would like to talk to you, then they can go to your website and do that.
Absolutely. There's also a contact button, so that would take you to like an email to me, and you can email me. It comes directly to me. I answer all my emails, so no problem there.
Mhm. Fantastic. Dr. L, thank you very much for the interview. I know you have another appointment, so I don't want you to miss it. And I wish you continued success. And
Thank you for the opportunity. I love to talk about this. It's exciting because it is out of the box, out of the routine, even out of the routine alternative ways of doing things. But I believe it's extremely effective. And the main reason is I'm supporting my immune system. That's the critical element.
mhm. Yeah, yeah, no, it's really inspiring. And as I said, it's really important that cancer patients, especially cancer patients, know about the health benefits of a meat-based diet and that they are not afraid to eat meat, right?
Has to be healthy meat, has to be pastured, no chemicals, but absolutely without a doubt.
Mm,
The medical studies are there. The
right.
case reports are published.